Welcome back. Delighted to have with us now Dr. Michael Dobbs from the UK Stroke Program. Doctor, good to see you, sir. Appreciate you being with us.
Great to be here.
So we want to learn a little bit more about the UK Stroke Program. A lot of folks have heard the name, not quite sure, what exactly is offered there, and we understand it's quite a busy program here in the state.
That's correct. In the state of Kentucky, there are more than 10,000 stroke hospitalizations every year. University of Kentucky gets well over 10% of those. As far as what we can offer to the stroke patients, basically everything that is available at academic medical centers. Everything from custom-tailored stroke prevention, which we do for each of our patients that comes through, but also life-saving, leading-edge stroke procedures in order to break up clots in the brain that are causing strokes, or actually remove them by going inside of arteries and under X-ray guidance actually taking clots out and allowing blood flow to be restored to areas of brain that are about to die from stroke.
Now, is this a service that is sort of referred by your physician, or can someone who maybe has a family history and is concerned can come in and begin the process of learning more?
Oh, certainly. Well, we do take outpatient appointments for stroke at our stroke clinic, and the best way to get in there is to get a referral through a primary care physician. But most of our patient encounters every year are new stroke cases that come through the hospital from really all over the state.
I see.
The vast majority, 90% plus, of our patients are introduced to us in that way at the time they're having their acute stroke, just out of the blue. They weren't expecting it, and then they're in the hospital with a stroke.
So for folks out there that may be watching that may have a family history, a proclivity toward stroke, and are thinking about getting to an age where this could become an issue, and maybe age doesn't play as much of a factor here. Maybe it affects more of a spectrum of ages than what I'm thinking. How do they reach out to you?
Well, actually, the first thing that you can do if you are at risk of stroke is begin to control your risk factors. The number one risk factor that is controllable in Kentucky and around the country is high blood pressure. Get it diagnosed, get it treated, get it in the normal range. Control diabetes if you have it. A big focus of our stroke program is what is called primordial prevention. We've actually reached thousands of school kids in order to teach them about how to prevent the risk factors for stroke, which also helps them to know how to prevent risk factors for heart disease and other common diseases.
Very good.
It's been very exciting. This program that our University of Kentucky stroke nurses have actually engineered. It includes one particular case where they taught a kid about stroke warning signs. That day he went home, his dad started having a stroke, and he activated 911 immediately. Very
good. Well, Dr. Dobbs, we sure appreciate it, and what a resource for our community and for the Commonwealth.
Yes, we are here for the state.
The Stroke Program is, and keep up the good work, sir. Thanks for being here.
My pleasure. Thank you.
Back in just a bit. Stay with us now.